So good morning, and thank you all very much for being here on Zoom. I'm really appreciative of all the work that you're doing, taking care of homeless community members. One of the things that's getting me through these really, really crazy times is gratitude and really being grateful for the sun when it shines, for a roof over my head, and for really amazing colleagues doing really significant work in our community. So today we're going to talk about COVID safety and personal protective equipment. My name is Dr. Laura Miller. I'm the Chief Medical Officer at Community Health Center Network. CHCN is an organization that supports 8 of the federally qualified health centers in the East Bay. I myself am a primary care internist. I've taken care of patients at Lifelong Medical in East Oakland since 1999. So we're going to move through the slide set. All right, so welcome. And today what we're going to do is learn a little bit about coronavirus or COVID-19. We're going to talk about how it's transmitted and how to recognize symptoms and how to keep yourself and your clients safe. Really, the safety piece is going to be the majority of what the take-home messages are for today. And I do want to say one thing that is just incredibly clear about this moment is that information is constantly changing as the situation changes. What is true today may change next week as new guidance comes out. Just today, Alameda County Department of Public Health said that cloth face masks are important for everybody to be using when they're out and about taking care of their errands. So we're not talking about cloth face masks for patients and for you all, but again, that's an example of how rapidly things are changing. So what is coronavirus? COVID or coronavirus is a novel coronavirus, and what that means is that it's new. We have not seen this virus before. It emerged in Wuhan, China in late 2019 and spread rapidly. So because our bodies have not seen it before, we don't have antibodies. You know, normally in a disease, when you are infected with something, your body mounts an immune response. It creates antibodies to attack the bacteria or the virus. In this case, with the novel coronavirus, we do not have antibodies that protect us from it. So it is incredibly challenging. The disease that it causes is called COVID-19, and again, that 19 is because it emerged in 2019. The World Health Organization declared a pandemic on March 11th of 2020. The word epidemic means disease that is spread in a certain area. It reaches a certain level of intensity. A pandemic is declared when the spread of the disease is at a certain level across the world. So World Health declared a pandemic on March 11th, 2020. The disease that COVID-19 causes can range from mild viral illness with a little bit of fever, some aches, to acute respiratory distress syndrome. So 81% of people affected or infected with COVID-19 will have mild disease. These are folks who can be cared for at home. They do not need a hospital. People feel really rotten for up to a couple. There is severe disease. That's when people need oxygen and they must go to the hospital. That's about 14% of patients with COVID. And then 5% are critical. They need ICU care, and this is where we're hearing about the ventilators and lack of ventilators in this country. The ventilators essentially are the breathing machine, the respirator, that when people have to be intubated and a machine breathes for them. Their lungs are so damaged by the virus and by the body's response to the virus that they require critical care. They require the ICU. And that's the very sickest 5% of people who get COVID. So how is it spread? And this is a really important point for all of us to talk about and know and understand. So it's spread person to person. And this picture here talks about the difference between droplet transmission and aerosol transmission. So when a person, like this person here, coughs, they will spew out viral particles. And the larger ones drop to the surface and can remain on the surface. Smaller particles are aerosolized. They're small, they stay in the air longer, and they can go further. So aerosols definitely infect through being breathed in. We think that COVID is primarily droplet transmission, and that's why we talk so much about the surfaces. So droplets are coughed out. They are larger and heavier, so they fall on surfaces. Now, COVID can live on a surface for many hours. There's different estimates of how long COVID can survive on different surfaces, but it is in the range of at least 2 to 4 hours. So what happens is if droplets go on a surface and then we touch that surface, then we have virus on our hands and we unwittingly touch our faces. We tend to touch our faces a lot. And so that's really how we contaminate ourselves. Virus is on a surface, and then we touch that surface, and then we touch our faces. You may hear talk about mucous membranes. So the normal skin is relatively strong and virus can't get in, but the thinner skin, like the inside of our mouths, the inside of our noses, those are what are called mucous membranes. Our eyes are mucous membranes. They're thinner and more porous than regular skin, and that is one of the ways that COVID virus and other viruses can get into the body, through touching a surface, then touching our faces and our mucous membranes. So that's something really important to think about. Think about this graphic and those droplets on surfaces. We'll be talking a lot about surfaces. So what are the symptoms of COVID-19? Fever in 45 to 90% of patients. So I think it's important to realize this is a big range. And in patients who are hospitalized, fever definitely is up there in the 90s. But the lack of a fever doesn't mean you don't have it. So you have to be really aware for all of these other symptoms that could happen. People will have fatigue in 70% of patients, dry cough in about 59% of patients, loss of appetite in 40%, muscle aches, that terrible like aching where you just feel really, really tired and pained. That happens in about 35%. People will get short of breath. And then sputum production, when you have a gunky cough and cough up crud, coughing up crud in about 27% of patients. So not everybody at all will have this. So again, you know, initially I think the message was cough and fever equals COVID. Well, cough in about 60%, fever in some, so it really isn't just those two. You have to be really aware about other symptoms that could also be involved. I'm hearing more and more about GI symptoms, the loss of appetite or maybe some nausea. So all of those things need to be super aware of. What are risk factors that make the course of COVID-19 worse in a person? So we know definitely that older age is a risk factor for more severe disease. It definitely affects people of any age. We absolutely see that. But for folks over 65, it's definitely a risk factor for worse disease. So other things that also confer risk are heart disease. So that could be congestive heart failure, or having had a heart attack, having had a bypass surgery on the heart. Diabetes is a huge one. Diabetes in and of itself suppresses the immune system, and the worse somebody's control is of their diabetes, the worse their immune system is. High blood pressure is also on the list of risk factors. Makes total sense that chronic lung disease is as well. Smokers, long-term smokers, have emphysema often. Their lungs have already taken a tremendous hit from the tobacco. So when you get a virus on top of that, that's going to be even more challenging for those folks. Cancer, if somebody is under cancer treatment right now, often those are immunosuppressing drugs, the chemotherapy drugs, so that could make their course worse with COVID. And chronic kidney disease also is associated with immune compromise. There are other diseases like rheumatoid arthritis or Crohn's disease where the medicines themselves compromise the immune system. And of course, we always need to think about HIV. If people are CD4s are low, that could also clearly make the COVID worse. And then extreme obesity also seems to be a risk factor as well for people doing more poorly with COVID-19. You're in touch with clients, you're in touch with people all day, every day. How would you know if your client had COVID? Well, I think one of the things to do, and we're saying this now, is assume everybody has COVID and that everybody could be infectious. But ask about a fever, cough, shortness of breath. Do they have a sore throat, a headache? Do they have contacts with people who are ill? I mean, initially in the middle of March, early March, we were asking people about had they traveled to Wuhan and had they been on cruises. Those questions are out the window. They don't make sense anymore because we have a community spread of the disease. So do they know anybody? Are they in contact with anybody who's sick? And do they have a lack of appetite? Those are all the sorts of things to ask about. When to call 911. Clearly, if somebody can't speak in full sentences because they can't catch their breath, you absolutely need to call 911 or they need to call 911. If they have chest pain, very important to call. Also, if they're confused, when people don't have enough oxygen going to the brain, they will be confused. Now, granted, people can be confused for many reasons. But those are sort of emergency signs to think about. So we're going to spend a lot of the next pieces here talking about how to stay safe when you're taking care of people, how to go from home to work, how to be safe at work and go from work back home and keep your families safe. So that's our next part here. So one of the pediatricians at La Clinica did a very good point-by-point download on how to stay safe, home to work and back home again, and that's really what I adapted for this. And essentially what you want to do is think about home being your safe, clean bubble, okay, and work being not clean. And then you want to keep any contamination from coming home. So when you leave home, wash your hands to the elbows and your face. Put on clean clothes immediately prior to leaving home. I think a lot of us, myself included, are wearing the most comfortable clothes. So that's the same thing. And you want to, you can consider using scrubs. The medical community uses scrubs. They're super simple. They wear like iron, and it sort of helps keep a psychological separation between work and home. But if you don't have scrubs, wear a short sleeve shirt or something that can be rolled up to the arms. Avoid any flowy clothing. You just don't want pieces of your clothing touching surfaces. And minimize the number of objects you transport between work and home. Cell phones are huge, a huge concern. We set them down, we put them by our faces, so we really, really want to make sure that we clean all of our objects. Clean them before you leave home, clean them when you get home. So cleaning all those hard surfaces before you leave home, including phones, purses, lunch bags, etc. At work, it's really important to maintain social distance. And actually, I think we should change this again. There's a good reason to say physical distancing, not social distancing. But I guess it's physical distancing in social settings, 6 feet minimum. And really that goes back to that graphic of how far things spread when people cough. So we're asking everybody of you listening to use a surgical mask when you're not eating. You've heard guidance coming out of Alameda County Public Health, California Department of Public Health, possibly coming from the CDC, that everybody should wear cloth masks. That's me when I go to the grocery store. My husband when he goes to the post office. We should all be wearing homemade cloth masks. That's very new. It's an example of how things are changing rapidly, but that's to keep us from spreading the virus. What we're talking about now, though, is for you at work wearing a surgical mask, which actually gives more protection than a cloth mask. So wear the surgical mask when you're not eating. Use gloves if you're touching a client. And we always talk about hand washing. And so hand washing for 20 seconds. We've all heard that piece about sing happy birthday twice. Pick a song you like and sing for 20 seconds. And the graphic here is good, and we have this. It's basically how to make sure that you hit every single part of your hand. So you want to do your palms, okay? You want to do in between your fingers, like this. Okay, I don't know if you guys can see that. You want to do the fronts. You want to do the kung fu grip, the backs of the fingers. You want to make sure you do your thumbs and rub your fingertips. There are actually a lot of really good videos on this. But hand washing is very, very important. Wash your hands well before eating and eat in a separate area. Maybe outside, but keep food separate from areas that may be contaminated. It's also really important to frequently disinfect your phones, keyboard, pens, badges, door handles, elevator buttons, all of those things. It's really important to be disinfecting those. You may, depending on your setting, you may want to assign a person to be doing that work every hour, every 2 hours. It also serves, if you have a person doing the work, it really serves as a good reminder that we're all working together to try to keep things as clean as possible. The surgical mask. So you've got a little picture of a surgical mask here. This is not the N95. These are the little paper surgical masks. I've got one right here, if you can see me. They have a little metal at the top, and they're pleated like this, and we're going to actually show how to wear that. The N95s have to be fitted to your face, and they are really more for hospital-based workers. So we're talking about the surgical masks here. So when you're putting on a mask, clean your hands with soap and water. Take the mask out and look at it. Make sure there are no tears. Determine which side is the top. And again, the top has that stiff, bendable wire that you're going to use to mold to the shape of your nose. Usually the colored side of the mask is the front side. So you put the white side to you and the blue side out. The vast majority of masks that I'm seeing have these little elastic ties with ear loops, and they go behind your ear. And then you pinch it and mold it to your nose, and you pull it down over your chin. So the idea is to block the expulsion of particles by covering your nose and your mouth. Okay. This next video actually does a really good job showing that. So we're going to pray we get this going. We're going to praise it. It's done. This is a huge part. Oh, did I lose it? Hope I didn't lose it. Okay. Can you all hear me now? I need somebody to tell me I'm okay.
Yes, we can hear you.
Awesome. Okay, thank you. Beautiful. So the video was a little goofy, but I reviewed a couple and it did the job. So to take off the mask, what you're going to do is clean your hands like it showed, and avoid touching the front of the mask. Assume that the front of the mask is contaminated. And then you're going to take it off by taking off the ear loops, throw it in the trash, and then clean your hands. So one of the reasons we think masks are helpful is that they actually help us not touch our faces. Okay, so that's the piece on surgical masks, and that's really, really important. We put this in your packet, but it is a really nice, simple graphic on how to wear a surgical mask. So avoid touching it. Make sure you conform that metal piece to your nose. Clean your hands well before and after touching the mask. Cover your nose and mouth. It shouldn't hang by one ear. It shouldn't hang under the chin. It really needs to cover your nose and mouth. Throw it away if it's wet or soiled. This is actually from UCSF that asked that everybody wear masks Sunday, I guess it was Sunday the 30th or 31st. Anyway, so everybody is doing it at UC. Keeping it, store it safely if it can be reused, and then discard it when leaving the building. And of course, remove your mask before eating or drinking. We're also going to talk about gloves. So we are recommending that you wear gloves if you touch a client. Otherwise, wash your hands frequently and clean those surfaces frequently. Again, reiterating, door handles, countertops, pens, clipboards, just look around you. Any hard surface should be cleaned frequently. So we're going to talk a little bit about gloves. Because gloves are on contaminated surfaces, they are contaminated, so you don't want to get your skin dirty by touching a glove. So just think about how you want to do it. So when you are gloved, you want to take off the glove by touching glove to glove. Okay, so if I take it off my left hand, I'm going to touch the glove and pull off the glove. And then with my right hand that's now clean and ungloved, I'm going to slip off the other glove. So glove to glove and skin to skin. We'll do another video on that. I hope and pray. Dag nabbit, we're doing it. Okay. And I'm messing up again. Let me get back to the PowerPoint. My apologies. Oh, there it is. Wait a minute. Okay. Dag it. Okay, I think I got it. Thank you for bearing with me as I'm technologically challenged. So that's about gloves. So for our next slide, we're going to talk about what to do at the end of the day before you leave work. And again, this is about thinking that work is one area where there is likely to be virus, and home is your clean bubble. So at the end of the day, no, wait, let me just try. I got a hint from somebody. No, they want me to try this. Oh, wait. Oh, wait. Hey, hey, hey. Okay. Let's just get moving here. Okay. Okay, great. So at the end of the day, this is again about the home being the clean bubble and work being where there's likely to be virus. So at the end of the day, wash your hands and arms to the elbows and wash your face. Disinfect any objects that'll be coming home, like purses, lunch bags, binders, phones, computers, and wash your hands again. And that is a very long list of many things to bring to work. I think it would be really important to try to absolutely pare down the number of things you're bringing. If you can bring your lunch in a paper bag and throw it away, and just bring your cell phone and a small wallet, that sort of thing is going to be much better. If you can change your clothes at work, you would bring clean clothes in a bag. You would go somewhere you would change. You would take off your work clothes, put them in a plastic bag, and wash your hands. Then you would put on your clean clothes to wear home and leave immediately. Don't sit back down on a surface or a chair at work while you're wearing the clean clothes for home. At the end of the day, also, so if you get in a car, wipe down your high-touch surfaces. If you're on public transport, when you get home, clean your surfaces like a backpack or a lunchbox or a cell phone. If you can't change before leaving work, immediately change clothes upon arriving home, prior to hugging family members or sitting on furniture. You could change clothes in some open air space or in a garage. But just think about those clothes that are coming from the outside world as something you want to get off very quickly, get them rolled up and put them in a plastic bag. And then you would wash your hands again. Whenever I'm in a clinical setting, I'm doing this, I'm going home, I'm showering, taking off the clothes, I'm showering, and then I'm putting on clean clothes. And the dirty clothes are pretty much going straight in the washer. You can also put them in a plastic bag. You can wash those clothes with other people's clothing at home. That's not a problem. Use the highest possible heat when you're, the highest heat water when you're doing that, when you're washing clothes. So some final safety tips about keeping clients safe is really disinfecting surfaces, washing hands, and covering cough. These are things that you can be talking with clients about, okay? And then we're going to stop for questions. Before we do questions, I do want to give a huge shout out to all of you all for everything that you are doing to take care of humans out there. It is deeply appreciated. When I talk about gratitude and how that's getting me through the days, I have great gratitude for you all and the work you do. And also to the folks from PAETC who helped get this PowerPoint together. Literally, this PowerPoint presentation was an idea on Monday, and it is now a thing. So at this point, I'm going to go back to questions. I'm going to try to manage Zoom appropriately, and let's see what we can do.
Hi, this is David from Alameda County Healthcare for the Homeless program.
Hi.
I'm looking at the group questions that are going along so far, and going to be pushing a few out right now.
I think I'm going to stop the share. Does that make sense?
Sure.
So I want to see everybody as much as, there we go. I like the people. Okay. Awesome. Whew.
So the first question is from folks in a congregate setting, working in a congregate setting. How at risk are we from aerosol transmission in a congregate shelter setting? Because we understand that some people might be infectious, shedding virus through things like talking, shouting, singing, and coughing, and still not yet be symptomatic.
Right.
I think the question means that we can be doing all we can around hand washing and surface control, but just focusing on the risk of airborne exposure, aerosol infection exposure.
Right, right. I think in some ways the jury is still out around droplet versus aerosol. It is all the guidance that I'm seeing is talking more about droplet and droplets falling on surfaces. That said, if you are really close to somebody who is coughing, those droplets are in the air. And that is why we're talking about masks for all workers. And if anybody is coughing, they should also be wearing a mask. That's the other reason we're talking about the physical distancing as well. I know it's really hard in a congregate setting, and it's probably going to take a lot of reminding of people. It's really hard to give risk numbers. I think at this point, because we have such widespread community spread, we've got to assume that everybody is infectious. And I don't know if that answers the question. And I, it's one of those challenges because I don't think we have really good information right now. It's definitely more droplet than aerosol, definitely good to keep the distance, but I can't give a risk number. I don't think we know that number.
Great. The second question is, should highly immune compromised persons protect themselves from aerosol exposure by wearing an N95 for self-protection in a congregate setting?
That is a very good question. The challenge around N95s is that they have to be fitted appropriately. You have to have fit testing to see if they are actually really protecting you, that the seal is good. I think that is probably, I would worry about somebody who was highly immunocompromised. I think that would be, at this point, a conversation between worker, supervisor, and perhaps their physician in terms of what to do. I know that in our health centers, the health centers have been really looking at staff and their own risk factors like age and other issues and trying to make individualized decisions that way. Again, I'm giving a waffly answer in some ways, but I think that is an appropriate discussion to individualize.
Okay, some of the people on this call are also outreach providers in a street encampment or street setting. Is there any difference in our advice of wearing surgical masks and hand washing and stuff in a street setting?
Good question. So a hand washing in a street setting, it doesn't make sense because you don't have soap and water around. So absolutely that is a role for hand sanitizer. Absolutely. So, the washing hands piece doesn't make sense. Using hand sanitizer does. I think also you might want to consider wearing gloves all of the time in that setting rather than bare-handed. And I do think absolutely surgical masks. In some ways, it is open air, so it might be a little bit better, but I think you also have less ability to physically distance. So surgical masks and gloves.
Okay.
I see the question, what's the rationale
Okay.
for wearing gloves all the time on street outreach? I think it's my impression, and this is just me as a human, that it's a less controlled environment. So if you're in a hotel setting, you would be better able to be cleaning those surfaces periodically, whereas in an outreach setting, in an encampment setting, there are not going to be as many obvious hard surfaces.
Great. One question is, I'm in my office wearing a mask right now. That's because I'm trying to learn how to do that. But the question is, should we, when should we kind of be wearing masks? Like in our office, only when we're out and about in a congregate setting, or what?
Yeah, so it's interesting. We're figuring this out. Last week, I went to clinic to telehealth with patients, and we weren't required to wear masks. This week I went, and we were, in part because there were patients being seen on the floor where I was. So in the administrative office with no patient contact, no people contact, we are not saying to wear masks, but in contact with clients, yes. And like we said at the beginning, this is so rapidly changing because now we're all being asked to wear cloth masks when we go out and about and get our groceries. So I think that, David, yes, you're wearing the paper mask because you want to demonstrate it. It could be that next week we'll be asking you to wear a cloth mask out and about at your administrative job without patient contact, and save that surgical mask for healthcare workers and you all.
Great. I think it's easier to smoke a cigarette with a cloth one than a paper one too.
Yeah, right. Buttonhole, anyone?
In terms of there's questions around availability and supplies around surgical masks, and I wanted to just comment that yes, there are bottlenecks right now in being able to order surgical masks through our Emergency Operations Center. The Healthcare for the Homeless program is working on that. All of our EOC contacts are working on that and trying to identify how serious is that bottleneck? Is it a couple days or longer? We don't really know yet. Yeah. Are there what are the alternatives though? What are the workarounds in the short term to surgical masks?
The workaround, it's so hard, right? We're in this ridiculous situation around supply chain. I think we think of N95s as sort of hospital level, surgical as clinic, and taking care of sick people in the home level, cloth masks as regular person out and about in the world level. I think it's so hard to tell because of the bottlenecks. I would venture to say that if I had to lay down my dime, I would say going up to an N95 for the shelter and outreach work is going to be more protective for you all than going down to a cloth mask. And again, from what I'm on those calls too with the EOC, I think N95 supplies are better now than surgical masks. That could change. Cognitively, intellectually, I think that the surgical mask is appropriate for the work and the contact that you're doing. But if I had a choice in your role, between a cloth mask and an N95, I would take the N95. And I would hope that I could get surgical masks back in my supply cabinet sooner so I could let the N95s go to hospitals.
And just letting you know that Healthcare for the Homeless program has been distributing supplies as we get them, and we're going to seriously curtail our distribution of N95s to shelters and outreach providers right now, and try to get the surgical masks in that, because we want to direct the N95s to the hospital and clinical settings as best possible. Can you do another quick walkthrough around outreach providers in a street setting, from the time they get in their car to go out to a spot, to arriving at a spot, engaging with people, getting back in their car, and driving to the next spot? And that,
okay. So you would absolutely want to bring, wear really simple clothing, have Purell with you. You would, get out of your car at a spot, put on your gloves, put on your mask, go out and do your work. Take off your gloves with that glove to glove, skin to skin, and get in your car, because you can't really change clothes out there, right? I would keep your mask on, but don't touch your face with your bare hands. Get in your car, go to your next place, get out of your car, put on gloves, go and do your work, come back to your car, take off the gloves, glove to glove, skin to skin, and then repeat that. The real issue is at the end of the day, what are you going to do about your car? So that's going to be part of the getting ready to go home piece, is going to be cleaning the surface of your car with wipes, Lysol spray, paper towels, going into a place where you can change, taking off your clothes, balling them up, putting them in a plastic bag, putting on your clean clothes, and then going back out to your car. Probably the better part of valor is going to be to clean it again. Again, just think it's really the fact that you're not going to be able, your car is going to get possibly affected, because if you're out and about and people have virus and the virus is on your clothing and then you sit in the car, your car could indeed become a challenge. So again, thinking about cleaning it down before you get into it at the end of the day. It doesn't make sense to clean it during the day because I don't think it's going to really have that big an impact. And again, this is just me, a doctor, thinking logically. This
on videotape.
On videotape, I know. They're really good questions, and we're all doing the best we can and trying to think it through logically about what the right thing to do is.
Okay. The final couple questions around preserving or extending the use of masks. I would, since we've kind of learned now, there's 3 kinds of masks: right. Cloth masks, surgical masks, and N95s. Do you have quick recommendations or comments on preserving or extending the length or reusing of masks?
Yeah, so you have to consider that after, I think that after a day, the surgical mask needs to go away. It's not a good idea to put it in a bag and take it home or anything like that. If it gets wet or soiled, then absolutely you should take it off and get a new one. I think that wet or soiled piece is actually more thinking about hospital workers, if there can be splashes of vomit, blood, things like that. I suppose that could also happen for you all as well. So if it is visibly soiled, take it off. You could definitely take it off and set it down far away from your workspace at lunchtime, your eating space, and then put it back on, carefully not touching the front after lunch. Those would be my suggestions. I think 1-day use is entirely appropriate, not going for 2 days.
Great. One question I think was about the going home process that you went over. Is pretty much the same for those working in a communal setting. The answer is yes.
Yeah, and that protocol is in the written materials.
Right.
I did not write in the in and out of the car piece because I hadn't thought of it until the good question.
Right, because there's just an overlap between shelter health and street and outreach providers, and we're trying to kind of reel in everybody on this.
Got it.
There are no other questions except for how do you keep your glasses from steaming up when you're wearing things? Like,
try to get that seal as good as possible. I know, right? I'm a glasses person.
Oops, I touched it. I touched it.
You touched it. Yep, you touched it. Yeah, just try to get the seal, and then try not to puff and puff. Yeah.
It only started when I started asking questions. So.
Right.
Are there any other final questions from folks? Otherwise, I guess I would hand it back to Carrie to.
Carrie, yeah, there you are.
All right, I'm here. All right, so I want to thank you all for being a part of this. We will send out the PowerPoint, the handouts. We'll put the recording up on our website at Healthcare for the Homeless if anybody needs it.
One final question.
We do have one final question about bunk beds.
We can talk about next week as well in the shelter.
Yes, we will talk about this again, but we might as well put it out there now too. But is sleeping in bunk beds safe for social distancing?
Is it 6 feet? Yeah, physical distancing. Is it 6 feet?
I know that in a lot of the shelters they've been doing head to toe to try to make it, but no,
I'm making a face. I don't know. Head to toe makes sense. I would get a tape measure. And if your faces are 6 feet apart, then you probably are doing okay. And if you could put people not in bunk beds, but in more separate spaces, that would be better. It's really we're making do with what we have. Yep.
We'll talk about that more.
And we will definitely talk about that more on Wednesday for the shelter providers.
One thing I would say, I just saw a question about masks. Is this about the custom ink and masks? There are scam artists all over God's green earth trying to make money. It's really, really challenging. So I can't tell you to buy, not to buy, but just be really careful. If you do, get a really small sample first. It's just really challenging, and I'm super aware of scammers.
Thank you. One last question. It's about masks again, and it's laundry. How are folks going to wash their cloth masks, especially for folks in encampments?
Oh, Lord.
Yeah.
How do folks in encampments wash their clothing? Would it be laundromat and throw it in the laundromat? Is it, by hand? I don't know. There is information beginning to emerge that maybe just having something in the sunshine, in the UV light of the sunshine, can be beneficial. So that we'll just have to keep our eyes open. I don't think we know.
Thank you. All right, thank you everybody for being here. And again, we'll post this very soon. Keep doing the good work. And again, keep me updated if there are any concerns in the shelters, any symptomatic folks, anything like that. You can email me or email Healthcare for the Homeless. And Dr. Miller, thank you so much for being here and for putting this together so quickly.
It's my honor. You guys are doing the hard stuff.
So thank you so much. I really appreciate it.
All right. Take good care, everybody. Thank you so much, and stay safe.
Yes. Bye.
Bye.